what I'd like to do is talk about eye diseases and aging. So as we get older, like losing eyesight is one of the things. Eyesight degenerates. So can you talk about what are the most common issues that happen with eyes as we get older?
Yeah, so our eyes are, of course, like you mentioned, if you lose your eyesight, it's what people fear the most after getting cancer, essentially. So, year after year, there's these they send out questionnaires to see, what do you fear the most, and people, number one is cancer, number two is loss of your eyesight. So people fear more loss of their eyesight than getting HIV, for example. In the consequences of losing your sight is obviously, you lose your mobility, you lose your independence, and so it's associated with bouts of depression or very severe depression, and it costs healthcare system tremendously to deal with loss of eyesight. So it's a big burden as we age, just to start to lose our eyesight. So a number of things happen, and one of them we touched on earlier on is this hyperactivated immune system. So again, the retina is an extension of your brain. So a lot of the same type of mechanisms that occur in the brain occur in the retina. So biochemically, the retina, so the layer of neurons at the back of your eye, is part of your brain. So, same types of reactions. It's also got the same type of immune system. So it's a immune privileged organ. So along with the brain, the retina has a particular type of immune system, which is really specifically an innate immune system. So it's composed of a type of cell called the microglia. And then you have some other cells that can infiltrate, both the brain and the retina. And so essentially when you age, one of the things that happens is that you get this hyperactivation of these immune cells, so they start to be more reactive and start to, in a sense, produce more inflammatory factors. And in some cases, they're able to, kind of start to become more phagocytic, so they can damage local tissue. Now, one of the important things in the eye is that your photoreceptor outer segment, so this is the neuron in your retina that captures photons and transforms them into an electric impulse that is relayed via a series of interneurons to your brain. So this is essentially the first chain, or the first link in the chain of phototransduction. So those cells are obviously critical for sight and critical, for fight and flight reflex. So because you got to see the tiger that's attacking you or so on. So essentially, they're recycled, or the outer segments. So a whole part of that neuron is recycled. And we think around every 14 days, there's a recycling of those neurons. So obviously not all at the same time, but there's a type of timed recycling. And this is done by a type of cell called the retinal pigment epithelium. And so this is again, one of the most phagocytic cells in your body. So one of the cells that kind of eats up the most in your body. And I can actually, when I talk about the retina, I often talk in superlatives, like this is the most this or the most that, but it's actually, the retina per weight is thought to consume the most energy in your body. So it's a very relatively small system, but obviously, with the brain. So this is, very widely used statistic is that 20% of the sugar or the carbohydrates or of energy or blood and oxygen is consumed by your brain and your retina, right? So for its own weight, that's a huge amount. So again, you need both of those systems to have a survival advantage. So once you have the recycling of your photoreceptors, as you age, it's kind of like a race car that you've driven at a extreme speeds throughout a longer period of time, then some things start to break down. And so one of the things that starts to fail in the retina is this whole process of being able to recycle the photoreceptors. And so those cells that have, worked for several decades, all of a sudden they start to fail, or they're not recycling as effectively, or they're recycling and then there's a buildup of some of the lipids that end up kind of seeping out or being extracellular to the cell, and so you get these buildups of lipids, and this in itself causes an inflammatory stress. And so this is a condition called dry age-related macular degeneration. So essentially, you get a buildup of these substances or structures called drusen. So these are little yellow spots that you see at the back of the eye. As this progresses, so this doesn't necessarily mean that you're going to lose sight, and depending on what type of stats you look at, this is an extremely prevalent condition in society, but most people, or several people, so a large percentage, will not have any kind of major impact on sight. Then once those lipid deposits or those deposits of fat start to grow or get bigger, then we start to have a problem. So then we can start losing sight, especially if it's around an area of the retina which is called the macula. And so this is the central part of the eye, and it's around 2% of the surface of your retina. But it's actually where all the color vision occurs, or I should say the large majority of your color vision and your high definition vision. So once you start to get accumulation of these lipid deposits, if they start to invade the center of the eye or the macula, then you really have age-related macular degeneration. So this is a very serious condition that can obviously lead to severe compromise in sight. And at the same time, what happens is in around 10% of people with age-related macular degeneration is that the most highly perfused vascular bed in your body is right behind your retina. This is called the choroid. And so essentially the choroid starts to thin out. So, by mechanisms that are not fully understood, likely also due to some of the inflammatory stress that occurs with these immune cells that come to the back of the eye. So either from circulation or partially in the retina, primarily through circulation, and other mechanisms, again, that we don't fully understand, that cause a degeneration of that vascular supply. And at one point, there's an ischemic stress. So there's no more oxygen that goes to these photoreceptors and so on. So you start to get all this kind of buildup of factors that try to stimulate blood vessel growth, but those blood vessels end up breaking the back of the retina, or if you get a thinning at the back of the retina, and they can dive into the retina, and then you have a condition called wet age-related macular degeneration. So wet AMD, or neovascular exudative age-related macular degeneration. So those are kind of the worst case scenario in an aging eye, is when you get this wet neovascular age-related macular degeneration.
Okay, so what can we do to avoid getting this macular degeneration as we get older? I mean, are there particular foods or other habits that we should follow?
Yeah, so that's a very good pertinent question. Obviously, unfortunately, it's a bit hard to answer. Part of, there's been a lot of studies that have been done that looked at various molecular approaches. Right now, there's no drug that is approved. So this is 2021. There's no drug approved for the dry form of age-related macular degeneration. Some have gone up to phase 3 in the clinical trial realm. So, they're kind of on the doorstep of being approved, but yet, nothing's actually made it. So the probably prevalent way right now of dealing with dry age-related macular degeneration is through vitamin supplements. And this is something that a lot of ophthalmologists will prescribe to their patients. So these are rich in antioxidants, and they tend to slow down a bit of the progression of this age-related macular degeneration. Another thing that tends to work really well, and again, this is a fish diet, so it's not actually omega-3 fatty acid supplements. So that is not clear to what point it works. It used to be part of the original formulation of this of supplements called ARID, so age-related eye disease study. So it was this really large NIH sanctioned trial that followed the history of populations, and to try to really kind of understand what are the different triggers of age-related macular degeneration, what kind of interventions, some lifestyle interventions can interfere. And so initially omega-3 fatty acids were evaluated and found that they actually didn't have such a great concurrence with disease modification. Whereas if you look at certain nurse studies, then actually eating fish, especially cold water fish. So again, there's something in the fish that's not in the pill. So I think, there's, and it also, it becomes even more complicated, because if you're eating fish, then your socioeconomic status might be a bit different. You might have a different type of lifestyle choice, but certainly that was, that can be associated with this slowing down the process. So another factor, so these are, again, there's, it's age-related macular degeneration has genetic links, of course. So there's actually the very first genome-wide association study that was ever done was done on age-related macular degeneration, and they identified this immune protein called complement factor H that has a very high linkage to AMD, but yet environmental factors are also very important. So again, having that mutation will not necessarily mean you're going to have the disease. So it's not a monogenic disease, but it will heighten your chances of. But there's environmental factors like obesity, especially in males. So abdominal obesity in males is linked to age-related macular degeneration. So hip waist ratio. So that's a good thing for probably for everyone to keep in mind, but studies have so far primarily showed that in males. Smoking is likely the number one environmental or modifiable factor, I should say, linked to age-related macular degeneration. And yeah, so I think if you have a good diet, you keep your waistline relatively in check, and you don't smoke, you're certainly putting the chances in the right quadrant, if you want.
So you did experiment on eyes, and particular macular degeneration. We kind of touched on that. Did you? Yeah. Can you talk briefly about what you saw in terms of?
So macular degeneration has got a strong mitochondrial component. It's a really massive disease in terms of people are if everyone lives to the age of 120, 50% of them will have macular degeneration, and they'll be blind in their central retina. So it was very obvious. We kicked an experiment off, we did it, and it failed. We went back and we looked at it, and we found out why we think it failed. We selected the wrong subject population. Disease was too well established in them. The controls were their partners, because they live in the same house, they have the same food, they're similar ages. Those that we gave red light to did stunningly well, really stunningly well. However, there is a tighter experiment that has been done, much tighter experiment on macular degeneration. I know the person that has done that experiment very well, and the data are very positive. Now, what they did was they grabbed their patient cohort when when the first signs of disease were present, which was, in this case, it was drusen, these deposits that form in the eye. Some of our patients already had that central part of the retina starting to degenerate. Once the degeneration had set in, it was much harder to deal with it. The outcomes of that are great. And, I actually rang the guy up and I said, this is fantastic. You've done everything, you've corrected all the mistakes that I made. And it was great to see the result. Really good to see it. So if we've got the other great data sets that come out are things like Parkinson's disease. So if we look at a cohort of us as we age, macular degeneration, diabetes, Parkinson's disease. Parkinson's disease is fundamentally a mitochondrial disease. If we catch these things early, we can probably deal with them in many people and improve the quality of life.
Do you have particular kind of protocols to support aging eyes?
So eyes are really interesting. I am not an ophthalmologist at all, but I am sort of like intrigued by the eyeball. And so I know it's just amazing structure, right? I mean, it sounds kind of pathologic, but I love this, right? So as you age, several things fall apart. Number one, most importantly, that everyone sees is presbyopia, which is the inability to focus up close, right? And that has to do with glycation or stiffness of the lens, right?
Yeah.
The lens is really interesting because you try to block radiation out of every other part of your body. We cover ourselves in sunscreen, but the lens is attracting it. So there's a heck of a lot of free radical damage in the lens. And because there's not a whole lot of blood flow, there's not a whole lot of endogenous free radical scavengers. On top of that, it gets horribly glycated. So your lens is just a sit and duck. So what's amazing about this is everyone gets presbyopia roughly the same time, right? Pretty much everyone in their mid-40s pulls out their reading glasses in a restaurant. I know you've probably been out to dinner. Everyone passes their glasses around. It's kind of ridiculously pathetic, but they do, right? But what's interesting is, so if presbyopia is your only problem, carnosine eye drops are amazing. So it's the same thing that you would orally take, but it comes in an eye drop. I've been using them now for a decade, and my up close vision is perfect.
Wow.
It might not be true, but it should be true. There's a fabulous Russian study. They gave these eye drops to, 500,000 people, and their vision got significantly better. So it's truly amazing. And it also reduces the risk of cataract. They actually give these eye drops to dogs to cure cataracts. Like, Lord forbid we ever said to a human, we could cure your cataract, because then the ophthalmology people would go out of business because they wouldn't, be able to charge $5,000 to take out your cataract and put an implant. That being said, this will reduce the risk of cataracts. I mean, will it get rid of it completely? Probably not, but it will prevent a lot of this stuff. So that's one thing that goes wrong with your eyeball over time. The other interesting that changes is the rods and cones in the back of your retina deteriorate, right? When people are driving at night, they can't see as well. And that's because cones are for color, rods are for black and white, and they just deteriorate over the course of time. And eye drops don't usually get to the back of your retina. So that's something that comes through your systemic vasculature for the most part. And so different agents that are required by the rods and the cones do better there. Astaxanthin is a fantastic example. Astaxanthin was fantastic. It helps your vision, as do the other xanthins, the zeaxanthin, and there's a few xanthins. But if you ever look at eye health, it's all the xanthins. And it's just because those are the molecules that are required in the rods and the cones to keep your retina healthy. The other one that's really good is the SKQ1. It's called Vizomytin. It's another eye drop discovered or invented by the Russians. Guys are amazing. Before COVID, you could go on any Russian site and order Vizomytin eye drops, and it was fantastic. It's harder to do right now. You can get them on eBay, but Lord knows how long they've been out there. But SKQ, when it becomes more available once again, it's amazing for eyes, and it goes specifically to the mitochondria. It's a strong free radical scavenger, and it just really helps vision.
Lutein and zeaxanthin, do you want to do them together or separately?
Yeah, I think they kind of belong together. They share most of the clinical trials applies them together. And you are quite aware that, they are not new nutrients. But so this is very interesting to me, actually, because so first of all, to explain what they are carotenoid pigments. Usually they are responsible for, yellow, orange colors in foods. So for instance, carrots, almonds, bell peppers, corn, cantaloupe, they have them. And the classical effect, and this is the reason I would suspect it from, is that they're basically proven. They are causally improve macular degeneration. And if you see the marketing supplement, this is what they use for marketing. And this is actually half of the reason I included in vitals. So of course we want the organ team, so they improve eyes, which is a very specific, very few nutrients improve eye. So that's one way to target that organ. But I think they are missing. Because I read the literature, I know how hard it is, and somehow it seems at least as impressive, is that they are actually a nootropic. So they improve cognition. And if you check the literature, it's easier to improve cognition in people that start to exhibit cognitive decline, but it's really hard, like really hard to improve it in healthy young adults. So there is actually a gold standard, double mask randomized placebo-controlled trial in young adults from 18 to 30 years old, in which 10 milligrams of lutein with 2 milligrams of zeaxanthin improve basically intelligence, so cognition. And at first, there is also another study that shows the levels of these compounds are correlated, linearly correlated with intelligence. So it seems to suggest, the more you have, the better. But like everything in biology, there is a limit. And so we basically, above the dosage that we have in vitals, which is about half of what they sell in the normal, there are even other products of the gummies with just these compounds. Again, for macular degeneration, it already reaches the maximum that you can have from cognitive benefits. One caveat for full transparency, that it takes 1 year to see the effects on cognition. So as in the clinical trial lasted 12 months and they did the measurements at 12 months. So, and it's not surprising because brain is a very slow moving tissue. So it takes really long time to change. And you might ask me, okay, this is young people. What about, older folks? What happens? And there is also, again, 12 months clinical trial they used MRI at the same dosage. And basically they showed that it affects positively the gray matter volumes, so the size of your brain. And it seems to impact learning and also resting state connectivity, which is how well connected your brain is, which goes down with age. And as a bonus effect, in older people, it also increases HDL cholesterol.